Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by Mark Drugs, who specialise in the custom compounding of medications, assuring that the client gets the proper prescriptions for their unique needs and conditions. They work with practitioners, integrating knowledge and treatment of experts to create comprehensive health plans. Visit markdrugs.com or call Roselle 630-529-3400 or Deerfield 847-419-9898. Hello and welcome. Today our guest is Canadian pharmacist Amy Lamb. Thank you for joining us, Amy.
Thanks for having me, Linda.
So, can we find out first of all who Amy Lamb is? What is your background?
Absolutely. So I actually work as a compounding pharmacist in Canada. So LDN is only available as a compounded product in our country. So I've been exposed to it over the past 5 years as a compounding pharmacist. But just within the past 1 or 2 years, started doing a little bit of sort of the recommending of it, the assessment of patients for the appropriateness of the therapy. My background has been as a hormone consultant. And so my interest in that area sort of came about because of having a personal hormonal condition called polycystic ovarian syndrome, and recognizing that sometimes the conventional practices that are available to us in varying countries, and certainly in ours, were not meeting my health needs. So got a little bit involved in that way, and hormone balancing is just that. It's a manner of balancing the right hormones, and what I've recognized is when I met patients that their stress systems and varying counter or sort of imbalances in their body did not always just respond to hormone therapy, and sometimes there seemed to be a lack of balance of also their immune system. And that's where, especially with some of my thyroid clients and those patients who've had Hashimoto's, Low Dose Naltrexone has been an absolute game changer for those patients' health.
Wonderful.
So I've been doing primarily use of it in Hashimoto's patients. These patients, we have almost zero capability to get their thyroid symptoms balanced, regardless of how, say, the blood work and everything like that pans out. And in a world where we seem to have a very heavy immune response in the antibody sense of things, our cell-mediated response is not any good. So I had done some research into finding ways to better balance the immune system and the immune complement from that Th1 or that cell-mediated immunity to that to balancing and lowering an antibody-mediated immunity, and came across some excellent articles and of course through LDN research and other organizations like yours, information about its applicability to Hashimoto's, and it's just sort of flourished from there.
So do you have any patient experiences that you could share with us?
Absolutely. I think the most significant case that I have come across was a patient who had lichen planus, and she had come to me at the pharmacy with a prescription for immunosuppressant therapy and topical, and for just a wee 30 grams of it, it was going to cost her $100, and her whole body was covered in this infection or this inflammatory response. And looking into her history, I'd sort of asked her, had something major happened in your life? And she had a terrible miscarriage. And in the event of trying to mitigate, the loss of the baby, they had perforated her uterus, and she had an unhealing, it's called a hematoma or hole in her uterus for over 6 months. And this inflammatory response had started to happen due to that major stressful event in her life. And so she had seen every specialist available in this area, and was becoming very distraught because as the lichen planus creeped towards her hairline, there was a risk of her actually losing scalp hair in the areas where the lesions were spreading. And so, worked with her practitioner and decided to try the low dose naltrexone, and it started to clear. The lesions flattened within a month, and within 3 months, the discoloration was starting to go away. And I mean, she was just absolutely thrilled because at that point, everybody had just sort of told her that there wasn't really anything that they could do for her in that regard.
Mm-hmm. Well, I think she was delighted not to lose her hair.
Yeah, very delighted. And, she has since done a trial where she discontinued the LDN to see whether or not her immune system had reached a better balance. She noticed a little bit of itching, a little bit of reddening at those lesions, and this is within a 6-month period. So she's reinitiated that therapy, and we're going to continue on, considering how long it took to develop that and what a huge impact that's had. But I think historically, when we look at what we are doing as preventative and protective measures for patients these days in regards to infections, like we are giving vaccines for darn near everything. And normally when a body experiences an infection, it has a first-line cell response that happens, and then the backup plan is to use antibody and antigen-mediated complexes, and that's what vaccines and new medications are using. So in preventing some infections, we are eliciting an immune response in that antibody complement, and that's what's leading to an overactive, this autoimmune disease type state. And the conventional therapies right now have just been to be completely suppressing an entire immune system, which of course puts you at higher risk for all infections and of course cancers. And, this has been the only agent that I have come across other than, trying to reduce stress and improving your nutritional quality, avoiding other irritants and allergens, that we actually can start finding a better balance and rebalancing that immune system without suppressing it entirely. And the best example of how it's not only suppressing the autoimmune issues, but it is improving immunity in other senses, it's using cancer. In Canada, cancer patients are pretty directed to their oncologists and specialists in that field. But we have a physician in our local city who has taken all palliative cancer patients and put them on LDN and ketogenic diets, and has been having amazing results. And these patients are thriving because instead of having a chemotherapy protocol that is absolutely ravaging their body and harming their intestinal cells and making them as ill as those therapies can do, we're rebalancing the reason that they lost control over those quick growing cells in the first place. It's revolutionary for sure.
Mm-hmm. And have you had reports from patients using LDN for other conditions that you could share?
Absolutely. We've actually recommended it for our MS patients. We've been recommending it Crohn's, I think a little bit due to the infection. It seems to have just an absolutely, almost a remission-like state with a lot of these irritable bowel syndromes. The use of it even in arthritis has seemed to improve, and especially the rheumatoid arthritis. We've had patients who've already seen a big benefit to that. And we're using it as part of larger protocols, understanding that inflammatory disease does not come from nowhere, and knowing that you can actually pair these therapies with an understanding of, okay, let's lower some sugar, let's increase healthy fats, let's do some avoiding of irritating foods and toxins and things in your environment. And so it's really become an absolute sort of the center of any autoimmune disease protocol, and it's a real ace in the hole when it comes to these patients, because their next step are things like biologic therapies and extremely expensive immunosuppressants, and this has been an affordable and manageable way, and patients are getting a better control over not only their autoimmune diseases, but they come back saying things like, and then my allergies went away. And I used to get sick once or twice a month, and now I'm not doing that. I don't have sinusitis infections anymore. I don't have any of these things. So, we sort of look at it as if there is something that has an autoimmune etiology, that the safety profile of this agent and really the rationale behind why it seems to be working in these patients makes it a, what do you have to lose from trying something like this? You get a little bit of vivid dreams and maybe a little bit of drowsiness. It's been a game changer. The last piece is I have several family members who have fibromyalgia type symptoms, lots of pain, lots of fatigue, inability to really function to the best of their capabilities, and this has been a really important agent in changing their lives, and they're just shocked. The reports of saying, like, I woke up this morning and I didn't want to cry for death. I actually felt like I could get up and that I could take on the world, and that's been really impressive. My experience with it, especially honing in on those Hashimoto's patients, is that sometimes there will be autoimmune conditions like Hashimoto's that are so severely intertwined with the entire functioning of that human body that sometimes starting at even lower doses of the low dose naltrexone, so the 0.5 milligrams, might be necessitated because their immune system has been so compromised for so long that they'll often go through a detoxification or a clearing of an infection that they didn't know that they had until they started the agent. So I've had patients start to dispel a tapeworm. They all go through, if they have yeast or fungal overgrowth, that starts to die off. But yeah, it's been overarchingly a really, really cool agent, and I can't say that there's anything else on the market that has this kind of impact on balancing the immune system.
I mean, you were so right with what you were saying, that other factors come into play, like your diet and supplements and things. Some people think LDN is just a magic pill that they can take it and, hey presto, they're going to be fine. But you still have to work at it. It doesn't cure you completely. You have to actually watch your diet, make sure you have the right supplements, and exercise is really important as well. It's not the be-all and end-all. You still have to work at it.
Exactly. I practice in an area of medicine we call functional medicine, and that just basically means that we're trying to balance out what are those negative impacting factors in your life. What are your stressors? What are your allergens? What are you actually encountering on a daily basis? Whether it be toxins, and if it's gluten or if it's mercury, how are we going to best mitigate that damage and remove it? Because if you have a pail that's supposed to be filled with water and there's a gaping hole at the bottom of it, we can only fill it with so much, and it's just going to keep draining. And the other end of it is yes, nutritional therapies and eating well and recognizing those things and understanding that your body is absolutely phenomenal, and that's why we don't really want to suppress it entirely, and we don't really want to change the course of how your enzymes function and all of these really severe pharmaceutical sort of degree-like agents. This is balancing. This is supporting the normal functioning of your immune system instead of really altering it or changing it entirely. It's getting you back to a better balance that it's supposed to function at. But finding a practitioner in your area that can help guide you through even understanding what are those things that are negatively impacting your health, so that you can at least reduce the size of the hole in the bottom of the bucket, so that when we start pouring in some positive herbals, nutrients, pharmaceutical agents, that they actually have a greater impact on your life. And the one thing that I have learned that is absolutely and entirely crucial and the center of the development of any and all disease is stress. And, a moment of severe stress or anger will suppress your immune system for 12 hours. So it's really important that that you identify what your stressors are internally and externally, and work with those, and really give yourself this shot, because it is a pretty miraculous therapy that's out there. But this imbalance of the immune system does not happen from nothing. And it's important to identify what those causative factors are, and help deal with the cause of your disease, instead of sometimes just applying a Band-Aid at the end of it.
Mm-hmm. What forms do you supply or compound LDN in your pharmacy? Do you do a liquid, a sublingual, a cream, as well as capsules?
Primarily the capsules. We have some younger patients who we will compound the liquid for, and we're always doing it in a non-inflammatory base. I know sometimes capsules will be compounded with a lactose base, and lactose is fairly inflammatory for most people. So we're using inert bases. We're using color-free capsules, trying not to stimulate immune responses with things like red dyes. Sublingual might be appropriate theoretically, and I have tried that for some Crohn's patients who have been using, even their vitamins as sublingual in belief that the intestinal tract is so ravaged by disease that it may not be able to absorb the agent. But without understanding, the impact of that, other than theoretically, we do stick with the capsules, and it's easy that way, and we just do it in varying dosage and dosage forms depending on patient needs. That's the wonderful thing about being a compounding pharmacist, is that you can do something in any way, shape, or form for somebody to meet what they require from you.
Mm-hmm. Do you have any children, for example, who are suffering with autism?
I do. What I have found, and I have a fairly small practice, but those patients that are coming to me, we haven't got to the opportunity to do that. There's varying spectrums of parent involvement in a disease so severe as autism, to the point where it's a new diagnosis, and we're really just talking about some of the very, very basics, and we will get there. Whereas I have patients who spend hundreds of thousands of dollars to see practitioners all over the world, and that's an opportunity where we're trying to educate those specialists, but we're also trying to touch base with some of the pediatricians. But I find that there's two areas of medicine that the caution of practitioners is highest, and it's with pediatrics and it's within oncology, and it's just due, obviously, to the sympathies to both of those areas. So it's an education piece, and being that it is not at this dose and for these purposes has not done a 100,000 person randomized controlled trial, there's caution against using it. But what I've been able to do, especially even with the most cautious of practitioners, at least educate them to the point of, let's step back and understand the physiology of why this is working. As any healthcare practitioner, you understand pharmacology, you understand physiology, you understand how the immune system works. And sometimes it's just a reminder where they go, oh, geez, that sure does make a whole lot of sense. And what's the negative impact here? And when I tell them, okay, so as opposed to the cancer risk that you're going to get with immunosuppressant therapy, the osteoporosis risk of prednisone, your risk here is that they might clear out an infection that they already have. They might get a vivid dream, and they might get a little drowsy. And, it sometimes has to be a last agent. I'm hoping that with greater exposure and these patient cases working out the way that they have been just so phenomenally, that it's going to start working its way to being a first agent, because it should be. It's, we should be starting with the things that are not harmful. We should be starting with the things that are lifestyle and preventative, and at least, as not necessarily an alternative, but a complement to that, right? Yes. You don't have to stop the regular plan to be able to give a little bit of almost this functional support.
Mm-hmm. And we have the LDN conference coming up in September in Portland, in Oregon, and we have two psychologists who will be talking about LDN in mental health issues, and that's another really interesting area, and with post-traumatic stress as amongst their list of conditions that they're going to present, and they're having really great success. And as you were saying,
I totally believe that.
And as you were saying about pain as well, and we have a Canadian doctor who I interviewed a few weeks ago, Dr. Richard Nahas from the Seekers Centre, and he uses it in brain health with the people that have had brain injury, and that is so exciting, really, really exciting.
Yeah, it's essentially reached, it's reaching areas of medicine that we didn't have an answer for. And you think about brain health and autism and fibromyalgia and pain and PTSD, these are neuroinflammatory conditions. You have either a existing viral infection, or you had damage to that area, or you've had chronic stress or neurotransmitter dysfunction. And once that brain and once those nerves become sort of lightened up and on fire, it's almost impossible to quell that fire. And by using this agent, you're actually giving an opportunity to slow down that excessive neurotransmission and that damaging neurotransmission. I mean, it's got a real potential impact in most areas of medicine, because even any sort of chronic disease, if you've had heart disease, if you've had, even some of these metabolic issues, again, a lot of that comes down to a neuroinflammatory state, even diabetes. Theoretically, this could have a huge impact on something like that, because that is an inflammatory state. It's stress elicited. It's a potential for all sorts of things, and cognitive health would be huge.
I know there are people who are using LDN for type 1 diabetes, but personally, I was a type 2 diabetic after having taken really high doses of steroids and so on, and they're really nasty. I wouldn't take it again. Yeah. But anyway, I ended up a type 2 diabetic, and I'm on a gluten-free, dairy-free, processed sugar-free diet, and I'm touching wood here, a diabetic in remission, and I was on metformin, and my results weren't very good at all. The way you measure is different than we measure here in the UK. But it means now that once you've been diagnosed as a diabetic, you never lose that label as being a diabetic. But the tests show I'm pre-diabetic, I am at risk of becoming a diabetic, but by the tests, I am now not officially a diabetic. So I am thrilled.
No, and it's amazing how much you can accomplish with lifestyle changes and understanding, that, you probably don't, if you never ate a carbohydrate for the rest of your life, you won't die, and that's an impressive understanding. The impact of LDN and ketogenic diets when it comes to sugar regulation and stress and insulin and everything is pretty impressive. Mm. Now, I feel very blessed to have entered this. It's a little bit of a unique field of medicine, and it has certainly revolutionized my health and revolutionized that health of my patients. Those patients who have, miscarriages due to a little bit of autoimmunity to their own growing ovaries. That's a huge application here. And even in higher doses, naltrexone has been shown to suppress increased insulin secretion as well. So patients that have, like PCOS patients who have huge surges of insulin, this actually helps to kind of quell that. So it's something that in low doses has a different effect than in high doses, but both so clinically relevant and again, at the risk of just rebalancing a mismatched system.
Mm-hmm. I found you were talking about women and their ovaries and so on. I actually had endometriosis quite badly. And would you believe LDN has cleared that up more or less? I was having different operations every 3 or 4 years, I guess. I have had so many D's and D&C's, it's unbelievable. I started those when I was 17. But I haven't had anything since starting LDN.
I totally believe that. Our training in endometriosis, and endometriosis is a terrifying condition. You know, it's as close to cancer without actually having that. You know, it's not going to kill you, but it sure feels like it's gonna. But I mean that is an inflammatory state. That's your body attacking itself in the same way as any autoimmune issues, and so controlling the inflammation through this types of therapy. It's an estrogen dominant type condition, so lowering your estrogen levels and rebalancing your normal progesterone, it would be an absolute excellent. And you know, this is another case of, okay, so we could remove your uterus, or we could give you this agent and actually fix the underlying issue. We could remove your colon, or we could rebalance your immune system. You know, we could remove your thyroid. And I mean, that's severe surgeries to go in and actually start removing organs because we don't know what's causing them to be inflamed, instead of addressing that inflammation, addressing that autoimmune state. You know, it seems pretty severe when this is the alternative, right?
I've interviewed so many doctors and nurses, practitioners of different kinds who have said that they had changed the way they run their practice because they were so disillusioned with traditional medicine, where they were just operating on people. They just decided that that wasn't for them. It wasn't necessary always to operate first. There are things you could do before you have to resort to that. But we're nearly at the end, Amy. For our listeners out there in Canada, could you tell our listeners, Amy, how they can contact you for a consultation or for a chat on LDN?
Absolutely. I am available in 2 different locations. So I work in both northern Saskatchewan and central Saskatchewan, at MediCenter Pharmacy in Prince Albert and Saskatoon Family Pharmacy in Saskatoon. We also specialize in dermatologic conditions and topical compounding, of which we've actually been able to use naltrexone against major scar formation, psoriasis, even eczema, and lots of different wound treatments. So, I mean, there's lots of opportunities and lots of utilizations. And you know, I just sort of encourage people to say, you know, if you can't find the answer to the question as to why am I sick right now, then you need to find a functional practitioner to help you find those answers and help you reach a sense of wellness and a sense of balance. And you know, medicines and medications are wonderful, and they've been able to stave off disease and keep us alive for all these years. But I think conventionally we've forgot that while we're providing this crux, while we're providing this Band-Aid, that we need to heal the patient.
And do you have a website that people can find your contact details on?
Sure. So I believe it's just www.saskatoonfamilypharmacy.ca, and then medicenterpharmacy.ca.
Wonderful. It's been amazing talking to you. Your experience of LDN is mind-blowing, and thank you very much for taking the time to speak to us today.
Oh, thanks so much, Linda. Thank you for having me.
This show is sponsored by Mark Drugs, who specialise in the custom compounding of medications, assuring that the client gets the proper prescriptions for their unique needs and conditions. They work with practitioners, integrating knowledge and treatment of experts to create comprehensive health plans. Visit markdrugs.com or call Roselle 630-529-3400 or Deerfield 847-419-9898. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.